I get this question more often than you'd think, and honestly, it usually comes from men who are a bit embarrassed to ask. But here's the thing, if you're over 60, this matters more than you realize. So let me ask you directly, what actually happens to your body if you're sexually active every single day? Does it strengthen you? Drain you? Could it actually hurt your health? Or is that just something your grandfather used to say? If that's something rattling around in the back of your mind, you're definitely not alone. I see it constantly in my practice. Men from their 60s, 70s, even into their 80s, wondering the same thing, but never quite getting a straight answer. It's one of those topics people whisper about. Lots of myths, lots of shame, but almost nobody actually talks about it openly. Well, today we're changing that. I'm Dr. Amara, and I've been a board certified urologist for over 15 years. I've spent my career helping men, especially men your age, take real control of their sexual health and their vitality. And in this video, I'm going to break down exactly what the science says happens in your body when you're sexually active daily, the real benefits, the real risks, and most importantly, how to figure out what's actually right for you, not what some internet article told you to do. By the time we're done here, you're going to have clarity. No shame, no guessing, just the facts. But first, and I mean this, drop a comment and let me know where you're watching from. I genuinely read these. And while you're there, hit that like button and subscribe because every single week we're talking about the stuff that actually matters to men's health, the conversations most doctors avoid. All right, let's dig in. Here's what I want to get straight right from the start because this is where almost everybody gets confused. There is no one size fits all answer here. Daily sexual activity isn't automatically good for you, but it's not automatically bad either. What matters, and this is critical, is why you're doing it, how you're doing it, and what it's doing to your body. I've had patients come in and tell me, Doc, when I'm active regularly, I sleep like a rock. My mood is better. I feel more like myself. And then I've had other men say the exact opposite. It leaves me exhausted. I feel less interested in my wife. Something feels off. Both of these guys could be absolutely right about their own bodies. So the truth isn't black and white. It depends on your individual biology, your habits, what stage of life you're in, and honestly, whether you're doing this mindfully or just going through the motions. Now, I want to say something to you directly. If you felt confused or even a little ashamed about asking these questions, that's not a failure on your part. Most men were never actually taught how their bodies work when it comes to sexual health. Think about it. You probably got a health class in school that was awkward and incomplete, and then nobody talked about it again until something went wrong. That's why I do what I do. After 15 years as a urologist, my mission is to take the complicated science and turn it into something practical you can actually use in your life. Think of this as a conversation between a doctor and a guy who genuinely wants the facts. My job is to help you understand what's happening inside your body so you can make smart choices, not choices based on fear or myths or what you overheard at the gym. So, with that in mind, let's talk about the genuine benefits of regular sexual activity for men. 5 real ones. Here's something that happens almost immediately. When you're sexually active, your brain does something pretty remarkable. It releases what I like to call a cocktail of neurochemicals. You've got endorphins, your body's own natural pain relievers. You've got dopamine, that's your motivation and reward chemical. There's oxytocin, sometimes called the bonding hormone, and serotonin, which keeps your mood stable. What does that actually feel like? You know that feeling right after where you just feel settled, calm? That's not just in your head, that's biology. Your nervous system literally resets itself. The tension you were carrying, that stress you've been holding in your shoulders all day, it releases. For men over 60, This matters because stress isn't just unpleasant. Chronic stress ages you faster, it raises your blood pressure, it tanks your immune system. So, if regular sexual activity gives you a real neurological reset, that's not just about feeling good, that's about your actual health. I cannot tell you how many men in their 60s and 70s have told me, Doc, I sleep better on nights when my wife and I are intimate. And there's a reason for that. After orgasm, your body releases prolactin, a hormone that basically tells your nervous system, all right, time to wind down. Mix that with all those endorphins and oxytocin I just mentioned, and you've got a natural sedative. If you're one of those guys lying awake at 2 a.m. with racing thoughts, or if you've been relying on sleep aids, this matters. Better sleep at your age means better recovery. It means sharper thinking the next day. It means more energy. It means your immune system actually gets the time it needs to repair and regenerate. Here's something a lot of men don't think about. An orgasm is literally a full body physical event. Your blood vessels dilate. Your heart rate goes up, sometimes significantly. Your circulation increases everywhere. And this happens regularly. You're giving your cardiovascular system a workout. Now, I'm not saying this replaces your walks or your exercise routine, but think about it this way. If you're keeping your blood vessels elastic and responsive, if you're maintaining good circulation, that's preventive medicine. And here's the part that matters to you directly. Better blood flow means better erectile function, better confidence in the bedroom. It's a circle. Okay, this one I want to spend a moment on because it genuinely surprises men. There was a major longitudinal study, Harvard, 20 years, over 30,000 men involved. The researchers found that men who were ejaculating 21 or more times per month had a significantly lower risk of prostate cancer compared to men who ejaculated less frequently. Why? The leading theory is that regular ejaculation helps your prostate stay clean. You're essentially flushing out old cellular material, inflammatory agents, things that could otherwise build up and potentially increase your risk. Your prostate isn't just some random gland, it's important to your sexual function and your overall health. And if regular sexual activity helps protect it, that's huge. And here's one more thing you probably weren't expecting. Sexual arousal and orgasm actually boost your IgA levels. That's immunoglobulin A, basically one of your body's first line defenses against viruses and bacteria. Combine that with the lower stress and the better sleep we already talked about, and you're looking at real immune support. At your age, immunity matters. You see illnesses hit harder, you recover slower. If there's something you can do regularly that legitimately strengthens your immune system, that's worth knowing about. Now, here's where we need to be honest. For some men, daily sexual activity can actually backfire. I've seen it. So let's talk about the real drawbacks you need to watch for. There's a massive difference between choosing sexual activity because you genuinely want it, for pleasure, for connection with your partner, for stress relief, and feeling driven by something you can't quite control. Here's the question I ask my patients. Are you choosing this, or is it choosing you? If you're starting to notice that sexual urges are interfering with your work, your relationships, your focus, if you feel almost compelled, like you have to, regardless of circumstances, that's when we've moved from healthy into problematic territory. And it matters because compulsive patterns can actually rewire your reward system over time. We all experience stress, loneliness, sadness, boredom. These are just part of life, especially as we get older. But if sexual activity becomes your only way of managing those feelings, we've got a problem. Why? Because it masks what's actually going on. You're not addressing the real issue, the loneliness, the stress, whatever it is. You're just hitting a dopamine button to feel temporarily better. And that dependency builds. The healthier approach is to think of sexual activity as one tool in a bigger toolkit. You've got exercise, you've got time with people who matter to you, you've got hobbies, creative outlets, maybe therapy or counseling. Sex is part of that picture, but it shouldn't be the only picture. Now, if you're over 60 and still thinking about fathering children, this matters. Daily ejaculation can lower sperm concentration. Sperm need time to replenish, usually 48 to 72 hours minimum. If you and your partner are trying to conceive, it's not about abstinence, it's about strategy. Spacing things out a bit could make a real difference in your odds. Paradoxically, too much of a good thing can dull your reward system. If you're doing this daily, especially if it's rushed or repetitive, your brain adapts. You're dampening dopamine's effect. And what happens? You start to notice less arousal, less spontaneous desire. Things feel a bit flat. The fix is actually pretty simple. Take breaks. Even just a few days without sexual activity can reset your sensitivity and bring the spark back. Here's what I see sometimes. Men get into a pattern of quick, hurried stimulation. Your body learns that pattern. And over time, it can actually condition premature ejaculation or create performance anxiety with a partner. The nervous system is smart, maybe too smart. If you train it to work in sprint mode, that's what it learns to do. The solution? Slow down. Practice mindfulness. Work on breathing. Train your body for rhythm and control, not just release. All right, so here's the real bottom line. Daily ejaculation isn't inherently good or bad. It's contextual. It depends on you. And that's actually empowering because it means you have agency here. You're not following some universal rule. You're making an informed decision based on your own body. So ask yourself these questions. Why am I doing this? Is it genuine desire, stress relief, intimacy with my partner, or is there something else driving it? How is it affecting me? Am I sleeping better? Do I have more energy? Or do I feel drained, flat, guilty? Does it fit my goals? If you're trying to conceive, you might need to adjust. If you're managing a health condition, that matters too. Here's what I actually recommend. Pay attention. Track your energy, your mood, your libido. Experiment. Try a week of daily activity. Try spacing it out. See what feels right for your body. Keep it balanced. Make sexual activity one part of a larger wellness picture. Exercise, good sleep, meaningful relationships, mental health. And here's the important one. Communicate with your partner. If you have someone in your life, talk about this openly. No shame, no assumptions. If you notice changes, anything with erection quality, any pain, any concerns about your prostate, get that checked. That deserves professional attention. If you found this helpful, I genuinely want you to hit that like button. Comment below and tell me, what's been your experience? What questions do you still have? I read these comments and I'm genuinely interested in what's on your mind. And subscribe because next week we're diving into something else men your age rarely talk about openly. Here's the truth. Sexual health is human health. It's not weird to ask these questions. It's not weak. It's actually wise. Because the more you understand what's happening in your own body, the more freedom and control you have in your actual life. And that's what it's all about, having the knowledge and the power to make choices that work for you. Whether you're 60, 70, or 80, your body can adapt. Your health can improve. Your vitality doesn't have to fade just because the calendar changes. So keep learning. Keep listening to your body. Keep building a life that gives you strength, freedom, and peace. I'm Dr. Amara. Take care of yourself. You deserve it.